This week Professor Macha would like us to discuss assessment for identification and intervention for students with severe and/or developmental disabilities.
What does she want us to know?
First, she would like us to understand the importance of identifying the early signs of developmental disabilities. Assessments in different areas must be performed. Early in a child's life, parents may notice a delay in one or more areas. Some children have global developmental delays, which means that they lag in all developmental areas, whereas some children lag in specific areas. The developmental areas assessed are speech and language, motor, fine motor, personal and social and global.
When evaluating speech and language delays, the following are evaluated: expressive language, hearing loss, cognitive processes, dysarthria, verbal learning disabilities, autism, developmental language disorders, and Landau-Kleffner syndrome, which is a disorder where children initially develop language skills but then they deteriorate. Did you know that children with motor delays are assessed for a combination of mental retardation and a visual impairment, or alone for cerebral palsy, ataxia, spina bifida, spinal muscular atrophy, or myopathy? When no motor delay is present, cerebral palsy is ruled out. Hypotonia, which is a state of low muscle tone, is the most common symptom of motor dysfunction.
I did. Did you know that when a child presents fine motor delays, visual impairment and being mentally handicapped are assessed first together? When assessing fine motor for delays alone, hemiplegia and Erb's-Klumps, which are types of paralysis, fractured clavicle, developmental coordination disorder, and disorder of written expression. Also, personal and social delays may be due to a cognitive disability, autism, or growing up in an abusive or neglectful atmosphere. When assessing autism, restricted and repetitive behaviors, and difficulties playing with others in an age-appropriate way are looked at. When assessing personal and social delays, mental retardation, autism, abuse, neglect and deprivation, and dysfunctional parenting are examined.
I believe I did read that somewhere. It has come to my attention that the challenge of early identification of disabilities is that, although symptoms may become apparent by the age of 12 to 18 months, parents sometimes wait until the child is 2 to 3 years old before seeking intervention. Research has found that children of some cultures are identified later and receive alternative diagnoses prior to being identified with autism spectrum disorder, ASD. Research also shows that girls are diagnosed later than boys, and doctors sometimes wait to assign a diagnosis for fear of placing a label on a child. Parents may hesitate to take action for the same reason. Furthermore, it is advisable that parents seek professionals with expertise in ASD assessment and do not rely on just anyone in the field. However, it is imperative that intervention take place as soon as possible.
There are no medical tests to diagnose autism. Diagnosis is based on communication, behavior, and developmental levels. There is a difference between diagnosis and eligibility. Diagnosis is based on the criteria set forth in the DSM-4 trail, and refers to a specific disorder such as Asperger's, is used in private settings, and is determined by an individual or team. Eligibility is based on the Individuals with Disabilities Education Act, pertains to a broad disability group, is only used in public schools, and must be determined by a team. When using the term eligibility, it refers to being eligible to receive special education services and to create an individual education program.
Due to the fact that ASD affects multiple areas of functioning, a comprehensive assessment that addresses a wide range of areas must be conducted by professionals in different areas of expertise. These include a psychologist, neurologist, pediatrician, psychiatrist, parents, and educators to assess speech and language skills, physical abilities, hearing and vision. The child's strengths, delays, and difficulties are determined, and an evaluation is made to decide whether or not the child is eligible for early intervention services. When using an interdisciplinary assessment, all professionals collaborate their information for diagnostic decisions. When a multidisciplinary assessment is conducted, professionals individually report about their areas, but there is no collaboration between them.
So, early identification of signs and symptoms of developmental disabilities or delays is crucial to assisting children and their families. There are many challenges to early identification and important factors in considering assessment and intervention. Families must be aware of the difference between diagnosis and eligibility. And, finally, families must also be aware of the difference between interdisciplinary assessment and multidisciplinary assessment.